A patient with diabetes has come in for a routine checkup. Which of the following tests should the medical assistant anticipate the provider will order? So now when we look at our choices here, these all look like typical tests that we would see on a well visit, just a typical checkup visit. You'll have your CBC, that would be your most basic one, and then we move into our thyroid hormone test, our basic metabolic panel, our hemoglobin A1C. So if these were all common blood tests that we would see on a well visit, how do we know which one this question is wanting us to anticipate? And if we look back at the question, we see that this patient is a patient with diabetes. So what this question is testing for you is which one is related to diabetes. And we will go through that, and we could also, by knowing the answers of what the other tests are showing or what they're related to, that could help you by process of elimination if for some reason you just weren't familiar with which one is most used in diabetes. So option A says complete blood count or your CBC, and that's just your basic blood count test that says about how your hemoglobin's looking, your hematocrit, different parts of your red blood cells, and just your basic blood cells, just for an overall idea of how you are in your overall health. So this is not specific to diabetes, so therefore this is not the test that this question is looking for us to get to. So we can eliminate that. However, something to note with CBC, if let's say this question was not asking about a diabetic patient, if you're just saying a patient in general and it said of these tests, which would be like the most basic test to get on a well visit, usually you would go with the CBC just because sometimes in very basic insurance plans, this might be all they cover. But just a side note, because that's not what this question is asking. This question wants us to focus on a diabetic patient. Option B is a thyroid stimulating hormone, or TSH, and that's what stimulates in the thyroid glands for production of thyroid hormone. And then by looking at this and seeing if a patient is over, under efficient in thyroid hormone, that could lead to a possible diagnosis of hyper or hypothyroidism. So that would be helpful in a thyroid patient, but we are looking for diabetes specific blood work. So we can eliminate option B. Option C is your basic metabolic panel, and that usually has to do with your lipids, your cholesterols, your fats, to see how a patient's doing maybe in a lifestyle, health-wise functions, but this question is asking more specific for diabetes. You might think, oh, maybe it's possibly related if you're looking at type 2 diabetes and lifestyle, but that's looking at it a little too much because there's another one that's very specific for diabetes care. So we can eliminate option C. And in option D, or you could see from process of elimination that this is what we will go with, your hemoglobin A1C. You might have heard about this in commercials for diabetes medication. Everyone's talking about lowering your A1C. So what exactly is your A1C? So when you check a patient's blood glucose level of a diabetic patient or just in general, you get a level that shows what their current glucose is for this one specific instance. So you check a patient's blood sugar and you see this is their blood sugar right now. Now, when you have your hemoglobin, which is your red part of your red blood cell, this lasts for approximately 120 days, and it will house the glucose levels. And by measuring what's your A1C of your hemoglobin, it's almost like taking a blood glucose level of a blood cell that lasts for 120 days. So it gives a better picture of how a patient's blood sugar is doing over a long period of time, as opposed to that blood glucose level that you get for that one instance. And therefore, this is used often with diabetic patients to get a sense of how are you doing overall, because if you take a blood sugar level at a random moment at a random day, that might not necessarily give a good picture of how they're doing overall, because maybe they just ate something sugary at this one instance, or maybe you caught them at a timer and they haven't eaten in a while, and that wouldn't be super helpful for a long-term picture. Therefore, if you have a diabetic patient coming for their routine check, the provider would like to see their hemoglobin A1C to get a sense of how they are doing in their diabetes management. And like we were saying about knowing what the others are for process of elimination, because we understand now what a CBC is, what a TSH test for, and what a BMP will be showing, you could possibly narrow down to your hemoglobin A1C to answer this question as well, which is the choice that we will go with for this question.